Over the past 24 hours, Alabama has seen more than 800 new cases of COVID-19, a significant jump in what we've typically been seeing from day to day when it comes to numbers.
Yeah, so we're joined this evening by NBC's chief medical correspondent, Dr. John Torres. Thank you so much for being here. And Dr. Torres, what do you make of the increase that we've been seeing in our state?
And Brittany and Ian, your state is not alone, but your state is certainly one of the ones that is seeing a sharp increase in cases. We knew this would be happening once we started opening things up and once we started getting people back out into public, because as we start congregating more, we do almost get that pre-pandemic mindset of we don't necessarily need the same protections we've had over the past couple months, and we start seeing these spikes in cases. The key is to make sure these spikes don't turn into outbreaks, and that means both on the public health sector, making sure that the government or public health entities do what it takes to keep them under control, but also as a community and as individuals, we all need to do the same things to keep that under control as well. And that's the big three things we constantly talk about: wearing masks, making sure that you're out there not congregating in large groups, and social distancing. And I know it's boring, we talk about this a lot, but those are the things that actually work.
Dr. Torres, I want to ask you about football. Voluntary football workouts are underway in parts of the state. We've already seen a few college athletes test positive for COVID-19. So what's your best advice for athletic departments and programs as they work to kind of get up and running in light of COVID-19 during these summer months?
And Ian, the best advice is to make sure they keep a very close eye if they do decide to open on what's going on, number one, in the community. If it's turning into a hotspot, they might want to think about backtracking a little bit and keep an eye on the athletes, the staff, the coaches, everybody, to make sure that if a case does pop up, they get not only that case under control, but all the contacts of that case under control and quarantined as well, because if not, it's going to spread throughout the program, and that means the whole program is going to be shut down. There are ways to do this safely. You just need to make sure you implement those steps, or else again, everything's going to be shut down. We're going to be back where we were a couple months ago.
Yeah, and too, sticking with football, based on where we are today, what do you think that the fall will look like when it comes to fans in terms of watching games in person? Are we heading in a direction where that could be possible?
I think it could be possible, and I think what you're going to see are stands, but with, again, social distancing and masks in mind. And so more than likely, you're not going to see the full stadium with fans in there. Instead, you're going to see probably 25, maybe 50% of the stadium filled and fans being separated into their clusters of groups that they've been quarantined with and they've been at home with over the past couple months. But you're not going to see the shoulder-to-shoulder fans that we've become accustomed to over the past few years. That's not there yet, hopefully over the next year or two, but I think this fall is going to be a new normal, not just for everyday lives, but for sports as well.
Real quick, Dr. Torres, I want to get back to states reopening. That economic argument about ending restrictions and getting people back to work. How do we look at that, and how do we best approach accommodating our lives around the virus in terms of looking at this long term?
And Ian, thanks for bringing it up, because I think the thing people need to realize and need to understand is that the reason we're reopening is not because we have the pandemic under control. Far from it. We're still in the midst of the pandemic, but we're reopening because we want to get the economy jump-started again. But you can do both at the same time. Jump-start the economy and keep the pandemic as best under control as possible. And that means when you do go out and about, making sure you're doing those things we're talking about, wearing masks, social distancing, not going in large groups. Otherwise, again, we're going to have to get that genie back in the bottle, get people back into their houses, be back to where we were a couple months ago, something that none of us really want to do.
Good information with Dr. John Torres today, NBC's chief medical correspondent. We appreciate you so much taking some time to chat with us. Much more on the latest with COVID-19 coming up here in about an hour on NBC Nightly News.